My presentation is on suicide rates in young girls. My problem statement is increased suicide rates in young girls. In this country, young girls aged 10 to 14 years of age are increasingly dying of suicide. Adolescent age is a challenging time when young girls start experiencing several biological changes such as puberty and menstruation. Some of the contributing factors here include mental health disorders such as anxiety and depression, family history of any psychiatric disorders, any physical, sexual, and alcohol use can increase in suicide rates. Bullying is another factor that contributes to suicide. Sexual orientation and identification such as LGBT or gay, lesbian, and bisexual young people face high rates of suicide because of not being accepted by the society. Socio-ecological model is incorporated into suicide at all levels. At individual level, the risk factors here include childhood trauma. The childhood trauma is very challenging for young girls as this is a very developmental stage with a ton of emotions that can impact their functioning, their impact on their functioning and their brain. This can lead to suicide. Any family history of suicide can increase individuals or young girls to commit suicide. The protective factors here can include religious beliefs. Young girls who are parents or who live in households of religious beliefs can have low rates of suicide, and young girls who are being able to seek or to receive treatment have lower rates of suicide. At the interpersonal level, risk factors include family and friends conflict, relationship instability, death in the family, or isolation or withdrawal. If any family relationship can be a boyfriend-girlfriend relationship, death can be either parents or any close family member. This can trigger suicide. Protective factors here include connection to the individuals or family support, good teaching about health-seeking behaviors and treatment can be a good protective factor for young girls to seek help. At organization level, evidence-based programs in schools and the community are very rare. This is very risk factors as these young people are not receiving the education, knowledge, and skills they need at the time when they may need it. Health providers, community members are not well trained or educated about suicide. Protective factors here can include reliable screening, tools and referral system, whether it's in the community or it's in the schools. This can help young people or their parents to seek help when it's needed. Community. At the community level, risk factors include uninformed community due to social norms, perceived discrimination, or communities with high rates of violence can be a problem or can increase the rates of suicide. Protective factors here include supportive school staff or community members that increase the services or coordinating services to increase care. At the policy level, risk factors include racial and ethnic inequalities. Individuals that receive racial biases during the time of care will avoid care for the next time. Perceived discrimination can hinder seeking for suicide. Protective factors here include funding for programs, can be either in schools or community. Resources can include events at this events either in the community or in the school. Resources can also be at the community centers to promote and reduce suicide rates. Interventions. There are 3 interventions that are listed here. The first intervention talks about how the population, it identifies young people that are faced with high rates of suicide. It was done through communication on social media platforms where young people really check their messages. For example, chat rooms like Twitter, Instagram, Snapchat, and other local news to promote education and reach young people and their parents. These materials were available to seek through availability of mental health workers, get appointment, referral, and lead to outpatient services for the youth to increase awareness and education services. The second intervention is emergency room intervention for adolescents. This intervention focuses on young people who are admitted in the emergency room following the suicide attempt episodes. The implementation phase will involve coordinating with the parents, teachers, and mental health providers to increase the outpatient services through the emergency care and increase counseling services and emotion support. The next, or the third intervention is screening suicide risk adolescents and young people in primary care services. This involves screening or mandatory screening for all young people, especially in schools and the community, even the ones that don't show any form of suicide signs of suicide. How will we evaluate that these interventions are working? For the first one, through the communication, we can collect data and then see how knowledge is increased and coping skills. The second intervention increased outpatient services such as training, education, teachers, social support, and counseling. Increasing services in the community will show that they will evaluate that the intervention is working. The third intervention will be evaluated through mandatory-based screening assessment through the evidence-based programs that are mandated for the schools to have one, for each school to have one, prevention education programs. There are potential challenges for these interventions. This includes financial difficulties. Some of the financial difficulties could be funding for the programs, or it could be funding from the parents to seek care where parents don't have enough money because not all parents have insurance. Funding for the programs, there are very few programs that are mandated, evidence-based, based in schools and all that. Discrimination and stigma, that's another problem. There's a big stigma of mental health illness as one of the most barriers to determine people to seek care. About 2/3 of people in America don't have mental health disorder and don't receive care. This is due to the stigma. Lack of managed care. After you receive the first care, how do you manage the process? That's another problem, that we don't have enough managed care. There's a growing problem of 75% of Americans with insurance, but insurance doesn't mean that it will cover everything. Solution: coordinating services with other community services, other community agencies, training and educating physical clinicians about mental health, implementing evidence-based programs in the school and the community. And implementing those, it will have to go through funding that is provided by the schools, either by the schools or by each state or county. and he is the logic model that tile between everything.